Alicia, have I shown you this before?
I don't think so.
I don't think so. We're trying to show our patients a little more carefully what we look for.
Okay.
So, in a healthy mouth, your tissue is nice and pale pink and it's nice and tight around the teeth. And when we probe under the gums, remember how I've checked under your gum tissue a little bit in the past? Okay, we measure that in millimeters. And that's what this is. 1 to 3 millimeters is a normal amount of pocketing under the tissue. That's 3 millimeters.
Okay.
And that's, in a healthy mouth, 1 to 3 millimeters is normal. You see the bone levels here? It's nice and straight. That's exactly the way you want it. Now, gingivitis is infection of the gums. On this picture, you can see a little bit of plaque. It's not a great picture, but you can see a little bit there. You can see some redness in the gums. Plaque can really irritate the tissues. Plaque and tartar both are big irritants. That's not a healthy situation. The bone is still fine, nice and level, and the probe depths are still shallow, 1 to 3 millimeters, but that plaque is irritating the tissues and making it swell. We don't want that to happen. Gum disease is progressive, and you need to take care of things at this point so it doesn't get worse. Periodontitis is a treatable condition. It is not curable. You can see how this tissue looks here. It's all swollen. It looks angry. The probe depths are deeper, like 4 millimeters. You can see some changes in the bone. There's a little bit of bone loss between the teeth here. And from there, it just gets worse and worse. Here, we're more like 4 to 6 millimeters deep. The amount of bacteria that gets down in there is tremendous, and it's hard to get that all cleaned out when it's in a deeper pocket. It's hard for the patient to keep it cleaned out, and so it just gets worse, and it gets into your bloodstream. It goes to your heart. It causes diabetes problems. Here's a little bit of angular bone loss on this x-ray. On this, it's even deeper than 6 millimeters. We have a serious, serious condition. People can really kill themselves by having such irritated tissues and not taken care of it. On this x-ray, you can see a lot of bone loss. This bone loss is clear down here on this bicuspid. It used to be way up there. That tooth is probably mobile. So where do you think you are? Most people say that. Most people say that. Well, let's take a look today. Let's check your gums, and I'll put an X-ray up there, and we'll check that with these X-rays. So I'm going to put you back.